Minister of Public Works and Infrastructure, Dean Macpherson, has launched an independent investigation into the Inter-Departmental Trust. Now, this is following corruption allegations related to an 800 million tender to install oxygen plants at health facilities across South Africa. The minister joins us this evening just to talk us through this. Good evening, Minister. Thank you very much for joining us on the program. Now, let's start with what prompted this route of an independent investigation. Just talk to us about the concerns you had with this 800 million project beyond the media reports on this specific matter.
Well, the first issue was raised by the Bongani Center for Investigative Journalism and the Daily Maverick when they first published allegations, serious allegations against the IDT, that is the implementing agent on behalf of the Department of Health for a oxygen plant tender, which had originally started at 215 million rand and then had ballooned to around 850 million rand. And the allegations were that the companies involved in this tender were not fit for purpose. They did not meet the medical requirements in terms of registration with the South African Health Professional Council.
Yeah.
And in fact, one of the businesses themselves didn't even have a physical address. So it was based on that a number of red flags were raised by us, and we started to look into the matter.
We understand that even one director is deceased, according to records.
That's right, and I cannot tell you conclusively how he passed or why he passed, but they simply said, well, you know, the business will be taken up by the staff of the company. Now, if your sole director no longer exists, then the business no longer exists. So it was just unbelievable that those ideas were even present.
Now, we understand, Minister, that you've been requesting that the board furnish you with documents related to the tender, but none were forthcoming. What were the reasons advanced for not sharing some of those documents you requested?
Well, there were a number of exchanges that myself and the board had, and I wasn't satisfied at first with the level of information that was given to me, and there was a backwards and forwards that kept going on. I then engaged the Minister of Health, and we worked in a bilateral fashion because they were the client at the end of the day, and the IDT reports to myself as the executive authority. We came to the decision that at the end of the day, these plants have to be delivered. They're life-saving equipment in hospitals across the country. And we just cannot have any form of corruption or allegations of corruption overshadow this, because this is not being funded by taxpayers. This is being funded by international donors. And so they were becoming increasingly nervous. And in total, South Africa gets tens of billions of rands in donor funding. So if there's even the whiff of corruption, it could threaten more than just this project, but many, many other projects in the healthcare sector itself.
Now, we understand that among the documents that you requested was the minutes of all bid evaluation committee and bid adjudication committee meetings concerning the oxygen plants contract. Did you get any of these?
We have got a number of documents. I do want to say that these documents are going to be subjected to the independent investigation. So I don't want to prejudge that matter. But suffice to say that the documents that we received were not satisfactory as to how rational decisions came about. And in fact, they left a lot more questions than they provided answers. And so that's why initially the board said that it was going to investigate the matter. I said that they cannot investigate themselves. That is unprocedural. And in fact, the board is not court, so it cannot take that decision in any case. So we believe, and I believe, that that departments cannot investigate themselves. That's why we'll be launching an independent investigation that will get to the bottom of this, how it came about, how the costs escalated by 800%, and how companies that did not have the required licenses and did not even have physically verifiable addresses were awarded these tenders in the first place.
You speak about the registration with SAPRA. But the real issue here is that even with the IDT, this was not a requirement when requesting quotations. Did you engage them on this? Why exactly it wouldn't have been included as a requirement that they be registered with the medical bodies? Because at the very least, the Department of Health had specifically indicated that they should.
Absolutely. Look, I mean, again, we just wanted to get to the bottom and understand how we got to the situation that we found ourselves, and those sorts of questions are going to be answered in the independent investigation. But it's very clear that you cannot provide health care equipment to a hospital without having the requisite licensing. So it is common cause that there should have been, from the very beginning, the licensing requirement. That they then sought to cure that a year later, I think is an indication that from the very beginning, the tender process was problematic and did not meet the requirements as set out and as required by the Department of Health.
It will be interesting to hear what the IDT has to say about all of this. We will try and reach out to Gwazim Shengu on the specific matter. But this matter doesn't just impact your department, but the health department, which is, of course, as you stated, in need of the oxygen plants. Has there been cooperation or better collaboration between the two departments in reaching this point in this case?
Absolutely, and I must commend Minister Motsoaledi. Him and I have been in close contact. We've spoken a number of times on the phone, in person, to chart the way forward. I've kept him abreast the entire time, and because at the end of the day, he too needs to deliver a service. Yeah. To those hospitals. So I think that it shows actually the power of collaboration and government, that when two ministers work together with a common agenda, that which is to provide services on time and on budget, we're able to also provide accountability and transparency when things don't go right, and that we're able to correct that as quickly as possible. And I think that that's what we've seen in this instance.
And then just, Minister, in closing, when will you be appointing the firm that will investigate this?
I met with my team last night. That process is underway. And as soon as we have appointed that service provider from a panel that we do have, a pre-approved panel, I will make those announcements. And of course, I will consult again with the Minister of Health as we proceed forward, and when we're ready to announce those findings. As I committed from the start of the 7th administration, that transparency is key and non-negotiable for us. I will present those findings with the Minister to the people of South Africa.
All right, Minister, we'll await at least the announcement now of the service provider that will begin that independent investigation. Thank you very much for your time this evening. That was Public Works Minister Dean Macpherson speaking to us.